My name is Shannon Springer. I was born and raised in Mackay in North Queensland. I'm an Aboriginal South Sea Islander man from there, and spent a few years, my younger years in Longridge out west, which is inland from Rockhampton. Went to school there for about 4 years before moving back to Mackay. I spent most of my life there, and originally I didn't start out to be a doctor or to be a GP, which I am today, or an academic for that account. I was really interested in playing rugby league, and I had a scholarship to play football, and after I finished year 12 I moved to Brisbane to try and pursue that career. Whilst I wasn't that good at football, I was playing, I also enrolled at university, and I studied a degree in Indigenous primary health care, which I studied around an environment of a whole range of people, a whole range of Aboriginal and Torres Strait Islander people, which were really inspirational for me. After finishing that degree, I decided to study medicine, and it was through a whole bunch of encouragement and support from a lot of non-Indigenous people as well, that I enrolled at James Cook University in Townsville, which had a strong focus about rural, remote, tropical health and Indigenous health. So I studied there. It was a 6-year course and I really enjoyed it. I had lots of placements in rural, remote areas in Kowanyama in the Cape, Ayr, Mount Isa, Charters Towers. So it was really, really inspirational for me to do that and to stay connected being in North Queensland. And continued to play football as well, which was also important. Finishing that degree, I moved to Brisbane, and I actually moved to the Gold Coast first to complete my internship, then went to the Royal Brisbane. I knew very early on that I wanted to be working community medicine. I loved getting out of the hospital context, around health promotion and disease prevention, and particularly trying to make some inroads around Aboriginal and Torres Strait Islander health outcomes. So I completed my hospital bare minimum and got straight out into general practice, and just before I finished my fellowship training, I moved back to Mackay and worked at the Aboriginal Medical Centre, where I was for the last 6 years, working with my own community. And that was really inspirational, working with your own family and cousins and relatives and seeing them as patients. And that's something, that can happen, working real remote. You can't have that professional divide. One of the differences clinically working as a doctor in a rural sort of practice is understanding your reality and what's around you. So for example, you don't have the same amount of resources around you, and you really have to think and work with your patients to making sure that you're getting the right diagnosis, because you just can't refer someone in the same town to the endocrinologist or the specialist or the neurologist, because that means that patient has to travel about 400 or 500 kilometres, a day of travel, an overnight's accommodation, to get a 20-minute consult, which is nothing in the city. So it really makes you think about, what are you doing for this patient, and what are you trying to get out of it for the patient, because you don't have access to CT scans, ultrasounds and all of these sorts of things at your fingertips. Patients understand and are quite willing to travel in these sorts of areas and work with you, because like I said, they're very fortunate to have those services sort of there. And they really trust your opinion. I think the expectations working in a urban sort of environment is that in order to get better care, everyone has to be referred off, and as a GP, you can sort of feel like you're just triaging and making referrals left, right, and centre. But I guess in a in a rural or remote sort of context, even more so. There are patients you hold on to more, that you will treat, and therefore your knowledge level has to be increased in certain areas, and that really helps. I would definitely advise them to go with an open mind. And certainly, whilst we like to think that, medicine and science is, the absolute, and wherever we go, it will be the same, it's not. So certainly go with an open mind, and enjoy the place that you're going. There are many parts of Australia that a lot of people haven't seen. And there are fascinating landscapes, and it's a place where you can learn a lot about yourself, if you embrace the environment and where you're going. Also, the opportunities to meet a lot of Aboriginal people that are living and working and doing their stuff on their country. And they're quite connected to culture and place. I think that's really valuable, and you can learn a lot from people in rural, remote areas like that. And probably the third thing is really try and become immersed in the local community. Community life is quite small. People will get to know who you are. And it really works both ways. So try to get to know your community, be involved in local activities, local events, also be involved in the school. I think these are great opportunities for building rapport with your community, and you'll get a lot out of that, and the community will certainly respect and welcome any visitors that actually do that. The things that I enjoy about working in these areas is even getting to work. So, for example, I've done some work on Palm Island. You have to hop on a plane in the morning with your stethoscope and then go to work. Working out at Charleville, we're offering services to Quilpah. You have to hop in a car at 6 a.m. and drive 2 hours and make sure you don't hit too many kangaroos, and that's just to get to work. So I think these sorts of things make it what it is. It's more than just hopping in your car in the city with your coffee and sitting in traffic and going to work. It's the environment, it's the people, and I think it's the journey on the way to the patient. It's just not about the patient and the medicine, and it's everything wrapped around it. And I think for me, I have those aha moments on the way to work. It's not always with the patient. It's not always in the clinic. It's what happens on the periphery and the outside, in the hallways. And I think that's what makes it for me.